about
No,
it.
we can see you at Nord's account. If they go to Norvidas Remkus account, they can see you clearly.
Wait, if they want to see, they need to adjust it in their side. Sorry.
Okay.
Yes,
I don't have the
If
option
they
of the
need to
gallery.
see, they need to adjust it from their
So
side.
yeah, they want to make the screen smaller and then view the gallery.
So go to gallery view, right? Okay.
Like in settings.
I don't
they
have the
can
option
do,
of the
like,
gallery
split
view today.
their screen.
Okay. So your femur sits in the hip socket like that. And then here is your knee. Okay, the other end of the femur. Okay. So because the angle can be changed by misplacement of the head in the socket, it can cause alignment difficulties for the knee joint. If this angle is decreased, the head of the femur articulates with the acetabulum in such a way the femur is more abducted, positioned at rest. This condition is referred to as genius varus or bow legs. So sometimes the way the femur sits in the hip socket can become a little bit outward like that. That means the knee has to adjust and go inward a little like that. So you get the bow legs. And if you have bow legs, so the femurs are like that, and then the are like that. Position. Times happens in the socket allows the common in females. Although you'll see it in the knees, actually the cause is the way your hip sits in the socket. There's a little bit of misalignment in the way the hip fits in the socket. Okay, Nord?
Yes.
Can you communicate with Debbie and find out why she cannot see me? I know we're trying our best to find out.
She can see the share screen. That's
Yeah, you can see the shared screen. Here, you just send her a message. Okay, Debbie, Nord's gonna talk to you. He's on my WhatsApp, so just send him a message. Okay.
this Norvidas Remkus. TV Sanchez is only for audio.
Okay.
That's it.
The wire it says Pee-wee Sanchez, that's only for audio.
The video comes.
Go to Norvidas Rimkus. Okay? And that's the video.
Quick question, can we confirm that the video is going to be like recorded?
Maybe if they are pinned on you, sorry, on you, that I'm share screening, they cannot hear you well. Maybe they need to like all fix a lot of the Rimkus and then they can hear well. It's just an idea. We can try it later.
Let's try it later.
Yeah.
Okay. So the femur ends in two condyles. Condyles are like nubs. So the femur, where it sits in the knee, ends in two nubs like that. And then the tibia underneath it has two depressions where the nubs fit in. It's like a cup and the saucer. The femur part is the cup, and then the tibia part is a saucer, and they fit together like that. Later in the video, you will see. Okay? So the tibia next to the femur is the second largest bone in the body. It forms the other half of the knee joint. And like the end of the femur, the top of the tibia has two depressions. So the femur's nubs fit in the tibia's depressions. Okay. So on the anterior superior tibia is a tuberosity of the tibia, a large and easily palpable bony prominence that serves as insertion point for the quadriceps femoris. So a tuberosity is like a bulge. And usually tuberosities are bulges where the muscles insert onto. So if you sit with your knee up like this, then on the top part of the tibia, on the front side, you will feel the nub right underneath the knee. Okay? There's a bony prominence, but it's not your knee. It's under your knee. So if you can feel your kneecap, you go underneath that, you're on your tibia. And you can feel underneath your kneecap, so it's not the kneecap, there's like a nub here. That's actually where your quadricep muscle inserts onto your tibia. So your quadricep muscle goes all the way down to the lower part of the knee. This is the quadricep tendon. And then it connects to the quadricep muscle. Okay. So if you sit comfortably on the floor or on your chair with your right knee flexed and halfway towards your chest, cup your patella with your right hand so your fingers are facing direction of your foot, and notice the depression at the lower part of the patella. Just below that depression, you will feel the tibial tuberosity. It's a bony nub. Okay? All right. So the lateral surface of the tibia is flattened to join with the fibula on the side. Okay, the tibia is elongated to form the medial malleolus, which articulates into the ankle joint. So we're only looking at the top part so we don't get confused. Let's now just go to the fibula and know that the fibula is not part of the knee joint at all. Okay? So the patella, your kneecap, is called a sesamoid bone. Okay, so a sesamoid bone is a type of bone that develops inside a tendon. The patella is like a rock in a sock. The sock is the biceps femoris tendon. I'm sorry, the quadriceps femoris tendon. So this is your quadricep muscle. Then when you get to your knee, it's now tendon. It's not muscle anymore. Inside that tendon, like a rock in a sock, is your kneecap. And then the end of the sock, the end of the tendon connects here to your tibia at the tibial tuberosity here. Okay. So it's like a shield, the kneecap. It's not really part of the knee joint. It's just like a protective shield in front of your knee. Okay? At the knee joint, this usually happens during second year of life. So babies don't have kneecaps. Babies only develop kneecaps when they start to walk. So around the second year of life, a baby will develop kneecaps because it starts to walk. Before this time, when the baby is crawling and waddling around, they don't have any kneecaps because they don't need them. Okay? So what is the kneecap exactly for? Aside from protecting the knee joint, it's the leverage for your quadricep muscle. So just like the heel bone is a lever for your Achilles tendon, the knee joint is a lever for your quadriceps tendon. And when do we use this lever? During the phase of walking, when you have to swing your back leg forward. So during the swing phase of walking, we use the knee cap as a lever. When the quadricep muscle contracts, the knee helps give it more force to pull the tibia forward. Okay. Any You guys understand so far? Yeah? Okay. All right. So there we have the quadriceps muscle, the tendon of the quadriceps, and the rock in a sock that is the knee joint. Okay? So that is the tendon of the patella rolls slightly inward. When the knee joint is contracted or bent, the patella moves outward. So the patella moves because the tendon moves. However, it's not unusual for the patella to drift either too far in or out and get stuck there. Sometimes it happens to athletes. Sometimes there are people whose um, tendons are very loose, and sometimes their knee gets stuck. Okay? So maybe you've seen or heard of someone whose kneecap gets stuck. This positional fault of the patella is usually caused by an imbalance in muscular strength in either the inner or outer side of the quadriceps muscle. Okay. This condition is called patellofemoral syndrome, when your kneecap gets stuck. Usually, when you strengthen your quadriceps, and especially these two guys here, the vastus lateralis and vastus medialis, then your patella has less chance of getting stuck. Okay, it happens to some people. And so if you have a friend whose kneecap keeps getting stuck, just tell them to strengthen their quadriceps. Okay. All right. So connective tissue. So you've got different tissues or structures that are connecting. So now we're on page 1112. Connecting these two bones together, the tibia down and the femur up. The main ligaments of the moving knee joint are called the medial and lateral collateral ligaments. So on the inside of your knee, so if you touch the inside of your knee, you will get the medial collateral ligament. And on the outside of your knee, you will get the lateral collateral ligament. So you can see the medial and lateral collateral ligaments on page 1112 on top. Okay, so that's the medial collateral ligament, and it kind of connects to the inner connective tissue of your knee. And then on the other side, the much thinner lateral collateral ligament on the outer edge of your knee. So these two ligaments give stability to any rotational movement of the knee joint. So it helps to keep this from happening too much. The medial collateral ligament, this big thick guy, is stronger because of the increased need for stabilization on the inner side of your knee. Okay? So the inner side of your knee, it's a little bit weaker structurally, so this ligament is a lot bigger. Okay. So the lateral collateral ligament, okay, right there, supports the outside of the joint. Okay. The medial collateral ligament is stronger than the two. Another important distinction between the two is that the knee is that the medial collateral ligament is also connected to the meniscus. So this big ligament, the medial collateral ligament, is connected to the connective tissue that is inside the knee joint itself. Whereas this one is not, it's separate. And that has an impact sometimes when you twist your knee in a certain way. You might also have problems with your meniscus, not only this guy here. Okay, we'll talk about that later. Okay, so this is one of the factors that allow an increased potential for injury at the medial knee joint, especially twisting injuries that occur when the foot is securely planted, the knee is bending, and then you rotate. Okay. So we'll talk about that later. Internal ligaments of the knee joint are called cruciate ligaments because they are crossed. So in the center of the knee joint, there is also called a cruciate ligament. There it is. It's like a cross stitch in the middle of your knee.
Hi, baby.
Okay. So you've got the anterior cruciate ligament, which is in the front part of the inner knee. Then you have the posterior cruciate ligament in the back part of the inner knee. And this is like the stitch inside your knee connecting the tibia and the femur. Okay. Now, here, right at where the femur bone and the tibia bone come together, we have tires, just like the discs of your spine, but for your knee. And they're called meniscus. You have the medial meniscus on the inside of your knee and the lateral meniscus on the outside of your knee. So these are the main protectors of the knee on the inside. The anterior and posterior cruciate ligaments prevent the knee from rotating too much and sliding front or back, while the lateral and medial meniscus are shock absorbers for weight-bearing stress that's affecting the knee. So there we have it. Let's talk about nerves. The two main nerves around the knee joint are from the sciatic nerve. If you remember yesterday, we were talking about how the sciatic nerve drops down from the top of the hip, and at the knee, it divides into two. One goes to the front of the knee, one goes to the back of the knee. So you've got the tibial nerve and the common peroneal nerve. Behind the knee, this is where the sciatic nerve divides into tibial and common peroneal nerve. The tibial nerve is larger. It passes directly through the back joint of your knee. And it goes deep in the calf muscle as it descends downwards. Okay, the tibial nerve has branches to the knee joint, proper in the ankle. It controls the muscles of the calf and the foot. The common peroneal nerve goes down the front of your knee.
Jullie volgens mij wil middag eten.
And it continues, winds around the fibula and goes deep into where the fibula is. So now, let's look at some of the muscles that are involved in the knee. Okay. So if you look on page 114, you've got the different muscles that go around the knee. Let's look at the thigh muscles and how they involve with the knee. This is actually the back of your leg. This is the hamstring group. Okay, on the back of your leg, you have the hamstring group, the semimembranosus, and the biceps femoris. The semimembranosus is the inner part of your hamstring, and the biceps femoris is the outer part of your hamstring. The hamstring muscle connects here on the tibia. So the hamstring muscles actually help to support the knee joint from the back side. And if you have strong hamstring muscles, those can act as support systems for your knee. At the same time, if someone is complaining of pain in the back of the knee, and here on the sides at the back of the knee, that actually might be that they have a tear in their hamstring. it's not uncommon in yoga for sometimes to have a tear in your hamstring and feel like it's knee pain. So one of the most common and unrecognizable issues for pain in the back of the knee, if it's on the side of the back of the knee, is hamstring tear. Okay. And if they do yoga, rule that out before anything else, because possibly it's a hamstring tear. Now this figure 9.11 is the front of your leg. In the front of your leg, underneath the tibialis anterior, you have the posterior tibialis right underneath it, which also connects a little bit to the knee joint. And we have the popliteus that winds around the back. Okay, this is actually, I'm sorry, this is the back of the leg. The tibia is in front. This posterior tibialis is right behind the tibia. And this is the popliteus, which kind of winds around the back of the leg. So if someone's complaining of knee pain in the back of the leg and it's not the hamstring, then the second culprit would be the popliteus muscle. A deeper muscle that actually helps to move the foot is the plantaris. And then you have here the gastrocnemius and soleus, which the soleus doesn't form part of the knee joint, but the gastrocnemius goes all the way up to here. So the gastrocnemius in the back and the hamstrings, popliteus and posterior tibialis are the muscles that support the knee from behind. And in front, you have the quadriceps and the quadriceps tendon, which helps to form knee. Okay. All these muscles are in charge of flexing or bending the knee. So any muscle in the posterior compartment is involved in bending the knee. Okay, and you can read through that later. There we have again the gastrocnemius, and it attaches on the femur. And so when you contract the gastrocnemius, you end up bending your knee. Whereas the soleus does not involve the knee. Okay. All right. So one of the misconceptions, we're going to kinesiology, about the knee joint is that it's a hinge. It's actually not a hinge. It doesn't just do this like your elbow. It doesn't just flex and extend. It also rotates. And there's a gliding action also during flexion and extension. During flexion, the femur rolls forward. So during flexion, the femur actually slides forward a little bit. And during extension, the femur slides back a little bit. And what keeps the femur from sliding too much forward or back is actually the ACL and PCL inside your knee. The healthy functioning knee joint also has rotational components. However, there are some people out there with zero rotation in their knee. So how do you know how much rotation you have? You bend your knee, you grab your tibia and you flex your foot. You take your hands and you try and roll. Try to get the tibia to rotate in or out. And look at how big an angle your foot is making. Okay, so how big an angle your foot is making. Okay, now we cannot see you in the demonstration. Okay, how about now? Can you see me? So flex the foot, grab hold, rotate out or in. Okay. So that is knee rotation. Someone is saying, I have a waiting for IV cam connection message. That's on Norvidus Rimkus. Go back to Pee Wee Sanchez.
The problem is, I've set it up so they would see the good camera, but some of them watch through you, and some of them watch through me. And so, whichever way I change it, like just all people need to go to same.
Okay, how do we solve this next
I
time?
feel that more people don't know how to see me, so it's better that everyone goes to PV's view.
Okay.
So then more people, like, without finding out.
Can
how
you
to show
quickly
it.
tell them?
Yes.
Come here so they can see you talk, so it's not creepy.
Right. What you'll notice now is that some of you are not able to see gallery view through your iPads or whatever, so I've set PV Sanchez on camera. However, this will turn off the camera of Norvidus Rimkus. So for the benefit of all, just go and choose PV Sanchez as the screen where the movement happens, and the share screen still goes through Norvidus. Yeah, I think I told it.
Thank you. Yeah, if it helps, it's a speaker. So
They're
speaker
okay
view
now?
is what my options are.
Okay,
and it works.
hopefully that helped. Okay, everyone okay now? We understand why it's happening. Okay, that's good. Okay, so as I was saying, the knee rotates sometimes. Okay, so during flexion, there's an unlocking mechanism in which the femur rotates slightly. Okay, so when you straighten your leg, you'll notice that your tibia external rotates if you lock your knee. So everyone, flex the foot, straighten your knee until it locks, and see which direction your foot moves. When you straighten your knee till it locks, you will notice the foot external rotates. So why did the foot external rotate? Because the tibia rotated externally when you locked your knee, which means that if you lock your knee in a yoga pose, you're actually twisting your knee. This is significant, and I had one case of one of my students who came to a 300-hour course. And just a disclaimer, she's trained with someone else for 200. But she had medial meniscus injury. And the reason why she had medial meniscus injury on both knees, we found out, is because when she stands for yoga pose, she hyperextends and locks her knee. And because of that, she was having injury in her medial meniscus. So if someone asks you, how come you're always telling me to microbend the knee when I'm standing in standing poses? Every time I do my triangle, you're always telling me to microbend my knee. Every time I go into a standing balance. The reason being, if you hyperextend and lock the knee, you have rotation. And possible, if you don't have good rotation to begin with, or the rotation it causes is way beyond what your knee is used to, then you're going to develop injury in your medial meniscus. Okay, so in a group setting, knowing nothing about how much people can rotate or not the knee, do you think it's a good idea to get people to hyperextend their knee? No, not at all. Okay. All right. So again, hyperextension of the knee. Okay, so the medial meniscus is the one that gets a lot of strain when you hyperextend or lock the knee. So this is the back of the knee, this is the front of the knee. The angle created causes a lot of strain anyway on the medial meniscus plus the rotation. Okay. This is the one that's important to note. Okay. Okay, so hyperextension of the knee joint occurs when the backward glide of the tibia and the femur is excessive, so that the joint moves past 180 degrees or a straight line. There we go. That's what's happening in your knee when you hyperextend. This hyperextension of the joint contributes to instability and stress on the ligaments. Okay. So now that we know about the knee a little bit more, I'm actually going to put this away very soon, and we're going to go to watch some videos. Meniscus tear injury is common amongst yoga teachers, especially vinyasa trained. Okay, I don't want to point the finger at anyone, but the reason why you've got a lot of injuries is because people are locking their knees, especially when they go into hamstring stretch. Okay, so you go into hamstring stretch and you lock the knee, that's going to cause you meniscus tear injuries. Okay, I don't want to say vinyasa trained, but I think more teachers in general should know not to lock their knees, especially in the triangle, especially in any standing pose. Okay, if you feel it when you do upward dog, you know what sometimes I do? I put my knees on the ground in upward dog. Okay? So if you feel it in upward dog, just bend your knees and put your knees down.
Piwi, can I ask a question?
Even lying on the back, no. Padmasana. Okay, that's due to too much rotation. And so now let's and we will talk about it when we get to the hip. But the knees don't like to rotate. But if the thigh can't do it and you force the leg into that position, the knee is going to do the job that the thigh isn't doing. Even though it's not the knee's job to rotate, it's going to rotate a little if you continue to force yourself into that range and the thigh has already reached its maximum. Okay. How do you know if you're locking the knee or not? Okay, so let's get a little up close and personal. And it's a good thing. It's a good thing that my knees actually hyperextend. Okay, so now as I am standing, I am not locking my knee. If you look at this femoral angle on the tibia, look at this line. Don't look at my calf muscle because it's quite chunky. Okay, how do you know that you're locking your knee? When the femoral angle is still smaller than or 180 degrees, your kneecap, if you press your kneecap like I'm doing now, if you press your kneecap doesn't move. The kneecap doesn't move because you've not hit past 180 degrees yet. Your kneecap is strong. Let me put my leg now to past 180 degrees. So 1, 2, 3. There. if you check out my femoral angle, it's actually around 120 degrees. What you will notice at this angle is that your kneecap now can move. I don't know if you can see it, but I'm moving my kneecap. And the reason why I can move my kneecap, let me go a little closer. The reason why I can move my kneecap is now my femoral angle has gone past 180. My kneecap moves. Whereas if I bend my knee, now the kneecap is not moving. So how do you know you're locking your knee? When you lock your knee, your kneecap moves. If my kneecap is moving, that means that my quadricep muscle is loose. My quadricep muscle is loose. My quadricep tendon is loose. That means that the front of my knee, here, if you can look at figure of hyperextension, see, the front of your knee is unstable. The kneecap is now loose. And there's a lot of strain on my medial meniscus because of the rotation that also happens when I lock. The best time to check this in a yoga class is when people do triangle or pyramid. If they do triangle or pyramid, check their knees. See if the kneecap is loose. That means they're hyperextending. Come up to them and tell them to micro bend. And if they ask you why, explain to them that you're hurting your knee. Okay. That's why when we do triangle or pyramid, what do? We micro bend the knee and we contract the quadricep muscle to keep the quadricep tendon tense in order to do its job of supporting the front of your knee. Okay. So thank you for all the comments that are coming in regarding the locking of the knees. I hope now it is clear. Very clean, amazing. If a person cannot hyperextend the kneecap, doesn't move when it's locked, right? So, yeah, if someone cannot hyperextend, obviously, you won't get to this angle and your kneecap won't be able to move, which I think is better, actually. Then you don't have problems of your knee getting stuck, and you don't have problems of damaging your medial meniscus because the range is not available. It's actually better. Yeah? Okay. So, rotation of the knee. Some people have it, some people don't. Therefore, in a yoga class, you always want to make sure that the foot and the knee are going in the same direction. You don't want the foot to go one way and the knee to go the other way. So when you're doing some kind of bent knee standing position, for example, like a warrior, okay, so if I'm doing a warrior and I rotate my lower leg in and I roll my outer leg out, my knee is rotating. So sometimes when you open the hip too much and the hip can't take it, you'll see the knee rolling in. That means I'm rotating my knee. In order to prevent this, it's not enough to do that, because the reason why this is happening is up here. So remember, when the hip can't do it, the knee starts to compensate. So we adjust all hip openers and standing hip openers from the hip rather than the foot, so that you're sure that there's no rotation of the knee. Okay, just a few practical guidelines when we talk about how to keep the knee from rotating during a yoga class. Okay. All right. Now, if you've got someone with knock knees or bow legs, let's talk about that because that's going to affect the way they need to position themselves in a yoga class. Okay. Pee-wee, I have a problem that my kneecap doesn't move. My knees got injured in Ashtanga class due to tight hip. Yeah, okay. I'll get to bow legs. So your kneecap doesn't move. You need to maybe send me a voice message and give me the details, Ruba, so that I can give you advice. So your knees got injured in Ashtanga class. In a few moments, we're going to go through the different knee injuries that we have, and we're going to talk about them one by one. And Ruba, if you feel that that's what you have, then we can discuss it openly with everyone. Okay? So bow legs. Bow legs, you look like that. Your knees stick out to the side. Okay. So other positional faults of the knee joint are bow legs and knock knees. Bow legs and knock knees. So genius valgus or knock knees is more common in women and is caused by the in part by the decreased angle of the neck of the femur. Because our hips are wide, it's very common for a lot of women to have more angle on their femur because the hips are wide. So the thighs roll inward more. And so what happens is the knees roll inward also. Okay, so this causes the knees to come together. So a student suffering from this one sometimes is unable to put her feet together in Tadasana because the inner part of her knees start to hit each other. Some of you might have this issue. When the Ashtanga teacher says big toes together, it's painful on your knees because your kneecaps or your knees are actually touching before your big toes do. It is advised for this. Instead of putting your big toes together, keep your feet hip width apart and roll onto the outer edge of your foot. So I'm going to stand on my chair and pretend that I'm knock-kneed and show you what that means. Okay, so I'm actually a little knock-kneed. So if I were to go to like normal, not trained by yoga, I would be like this. See how my knees are kind of rolling in. And when the Ashtanga teacher says, okay, big toes together, before my big toes even meet, my knees are already touching. And I might also have pain on this inner part of the knee because my femur angle is actually a little bit inward. So what do? First, I step hip width apart, then I roll onto the outer edges of my foot. Notice when I do that rolling, I'm actually externally rotating my femurs a little bit, and now that points my knee forward. If I have knock knees and I do a warrior 2, I end up looking like this. See where my foot is and where my knee is? What can I do? Roll onto the outer edge of my foot and then press the big toe down. And now I have opened up the angle just by the position of my foot. Roll onto the outer edge of your foot. That's another way, because if you're knock-kneed, the hips are internally rotated. We need to externally rotate the hip. Aside from closing the joint space from the back, I can also roll onto the outer edge of my foot in the front. So those are two ways in which to resolve the problem of knock knees in some standing poses. Okay. So now let's look at bow legs. Genus varus bow legs is associated with the increased angle of the neck of the femur. So your femurs, instead of adducting like that, are actually abducting a little bit so that the knees underneath them have to compensate. And so you end up looking like this. Okay. It is more common in men, but there are women that have bow legs as well. In this case, it might be difficult for the student to put the knees close together in Tadasana. So they have their feet together, but you notice their knees are far away from each other. Okay. In that case, actually, it's internal rotation that needs to be done, or at least strengthening the inner thighs. And when you strengthen the inner thighs, that kind of corrects the abduction of the femurs. So strengthening the inner thighs so that you can get more or less a smaller angle of the femur. Okay, so I'm going to put this away. And then we're going to go into a video. Screen sharing has stopped and the shared window is closed. Okay, 1 second. We're going to the video soon.
Now again. So like stop share and then share the window. This one, yeah?
Mm-hmm.
Dr. Nandu. Okay. And,
Okay. Okay.
just to make sure that. Share. Music.
I don't need the music on.
You
It's
don't
fine.
need sound?
No, no,
Oh,
don't need
okay,
sound.
okay, sorry, then carry
Okay.
on.
All right. So what we're going to do now is we're going to see a visual display. Can we also close this or just make it just me? Can you make it a little smaller?
Just click on one.
This one.
Yeah.
It's on you. Oh, there we go. Okay.
This is what they also need to do, like besides
Yeah.
this.
Okay, so hopefully now you can see. We're going to have a discussion after we finish this video. So after we finish this video, we can unmute and talk about it. Okay, so anatomy and structure of the knee. I gave you this link on the WhatsApp group. So if you want to watch this video again, it's with you. You already have it. Okay. So I will be talking you through it. Let's look at the bony structure of the knee. So there's the patella. And remember, it's inside the femur, biceps femoris tendon. This is how the tibia looks. This is the fibula, not part of the knee. This is the tibial tubercle, which I made you feel. And this is where the quadriceps femoris tendon inserts. Okay. Okay. And that's the femur above. These epicondyles are where different muscles connect with the bone. It's the front of the knee. There we have the quadriceps muscles and where they connect to the knee joint below. That's the tendon, and the kneecap is here inside. So the patellar tendon is a continuation of the quadriceps muscle and inserts into the tibial tubercle, which is here. Okay. So that's how the femur and the tibia sit together. So again, the condyles are like the cups, and they fit on the tibia saucers here. Two depressions here of the tibia. Anteriorly, the condyles are separated by a shallow depression called the patellar something. You don't need to know. There it is, patellar articulated surface of the femur. That's the little depression where the patella sits. Okay. Posteriorly, the intercondylar fossa of the femur. One second. Is present between the condyles. So this is an interesting view of how the femur and tibia sit together. So this is basically the knee joint. Okay. Intercondylar fossa between them, that's where the kneecap kind of goes. Okay. So anterior cruciate ligament or ACL. So sometimes you'll hear ACL tear. Now you know what the ACL is. It's here, the cross stitch in the middle of your knee. Okay. And then you have the other one. The function of the ACL is to provide stability in the knee and prevent the tibia from sliding too far forward. Tears of the ACL are one of the most common types of knee injuries. So if you have an ACL tear, I'll show you a video of how it looks. It's kind of disgusting. Okay. So that's the ACL. In the back, you have the posterior cruciate ligament or PTL. So this is the back view of the knee. The PCL originates from the tibia to the medial condyle of the femur. Function of PCL is to prevent the tibia from sliding back. Okay, ACL keeps the tibia, this is your tibia, from sliding forward. PCL prevents the tibia from sliding back. Okay, there you go. Usually, we injure ACL and PCL by collisions sideways or too much twisting. Here we have the medial collateral ligament. Again, this is the inner portion of your knee. And the lateral collateral ligament. The collateral ligaments are found on the sides of the knee and are responsible for providing sideways stability of the knee joint. There we go. Now we have the two tires inside your knee called the meniscus. So the meniscus is a tissue made of cartilage that acts as a shock absorber between the femur and the tibia. So right here, that's the meniscus right there. And it's in blue. That's how it looks. And here we have the ACL and the PCL. There we go, medial and lateral. Okay. There they are, medial, lateral. Two menisci of the knee joint are pads of tissue which serve to limit friction in the knee between tibia and femur. So the femur and the tibia, sometimes they will rub against each other, and the meniscus will help to prevent this rubbing from damaging the bones. Now there are also other structures called bursa. Bursa are like gel pads. You find them in the shoulder, you find them in your knee. So several bursas located around the knee that help reduce friction between the moving structures of the knee. Okay, so there we have a lot of bursa. And that's where they are. Okay. So now that we have a little bit of little bit of an idea about the anatomy of the knee. Now what we're going to do is look at injuries. Okay, so again, a little bit of a review. That's the nerve that comes down the back of the knee. That's an artery, popliteal artery that comes down the back of the knee. And here we have the joint of the knee again, cartilage around the kneecap, meniscus, the shock absorbers. Then we have the ACL and the PCL, the cross stitch that keeps your knee from sliding forward or back too much. Then we have the kneecap inside the tendon of the quadricep. It's actually just one tendon. And then you have the LCL and MCL, collateral ligaments, outside of the knee, inside of the knee. And that's the movement of the knee when you bend and you extend your knee. There you go. The quadricep muscle is the one in charge of extending your knee. Now, what happens if there's damage in the tendon of the quadricep? Okay, that's a normal extension. What happens when you damage it? You cannot straighten your knee. So we call this a tear in the quadricep tendon, basically. Patient is unable to actively extend the knee. So usually in that case, they do some kind of surgery on you and they get it back together, and therapy involves contracting and knitting back the space, and then stretching it to remove the scar tissue from the surgery. And it's a long, long process. Okay. Now, if it's below, which might happen sometimes, you can extend the knee, but not actively. Okay. This is most common, ACL tear. Remember, the ACL keeps your tibia from sliding forward. That's what it's supposed to not do, but if it's broken, it can't do that. So here are the common causes of ACL injuries. So traumatic force between applied during twisting motion. So you're in a Zumba class and you wore your running shoes and you twisted to the right, but your foot didn't. ACL tear. Okay? Or sidestepping or landing from a jump with the rotation in the knee. So the patients complain of immediate pain and the knee is giving way and there's swelling. Okay. And that's what they do. So if you've got blood in the joint, chances are it's ACL and meniscus injury. Okay. This is what happens when you have an ACL tear. There you go. There you go. So if you have an ACL tear, the tibia moves. If you take a common tibia like your tibia and you try to move it, even with the knee bent, it won't move. But if you have an ACL tear, the tibia moves upwards. So sometimes there's bruising of the bone because of an ACL tear. Okay. Then you have your PCL. Your PCL prevents, this is the front of the knee, this is the back of the knee. The PCL prevents the tibia from sliding backwards. And this is what happens. In a car accident, it's very common to get a PCL injury. There you go. So look at the picture. Normal knee with a PCL injury. See how the femur has slid backwards. There's a little bit of a sag. Okay. There we go. So this is how the doctors test to see, ooh, gross, if there's a PCL. And that's how it looks live. See the difference between this knee and this knee. Okay. So again, they do the same test and you will see that the leg can slide back a little bit. There you go, PCL injury. More. Okay. There you go. That's an actual person with a PCL injury. See this? There's a little bit of displacement of the tibia. There you go. Okay. So these are, why is it important to see this? Because if you can see what happens to a person when they have ACL and PCL, okay, there's a little bit of rotation. 10 degrees of external rotation indicates significant injury. See, look at that. Look at the rotation. Look at the difference. This is the injured leg. This is a normal leg. Okay, when they're prone. Okay. Why do you rotate so much? Because the PCL isn't there to stop the rotation from happening. So this is a normal knee without ligament injury. What happens if the lateral collateral ligament is injured? So remember, that's the outside of your knee. And that's what happens if there's medial collateral ligament injury. So if your lateral collateral ligament gets injured, you have pain and instability on the outer edge of your knee. And if you have a medial collateral ligament, you have pain and instability in the inner portion of your knee. Okay, let's see what is going on here. Someone has an ACL tear. Someone's knock-kneed. Okay. This is more common than this. Okay. Let's continue. Meniscal tears. Okay, there are different causes of meniscal tears. The medial meniscus is on the inside of your knee. The lateral meniscus is on the outside of your knee. The meniscus has a little bit of a blood supply on the outer edge, but on the inner edge of your meniscus, there's no blood supply. That means if you get a tear and it's here, it will heal very easily. But if you get a tear in the part where there's no blood supply, it's difficult to heal. There. So this kind of a tear will heal very easily. You have pain in the knee. You have pain when you straighten your knee. You have swelling and your knee locks and it feels very weak. Okay. This is a bigger tear. So this is only a small tear. This is actually a bigger tear where you actually have more damage and it's going into the part where there's no blood supply. Okay. All right. So now what we're going to do, that we've seen what the different injuries are on the knees. Now what we're going to do is we're going to have a little bit of a discussion about, if Nord, you can help me with the
What do
screen.
you want to do?
Yeah.
What do you want to do?
No more sharing. We're just going to do discussion.
Okay, so then I will turn it back to Nord here,
Yeah.
and this will make the camera better. So now they cannot see PV, but they can see.
Okay. And then how do I
Quit sharing.
expand this?
Yes, so here
Yeah.
you stop sharing, and then it goes back.
Ah. Okay.
This is PV, so it's frozen, you can see it, but
Yeah.
if you go on the host, it's all, you see, fast and nice.
Okay. Okay. So what we're going to do now,
Ask them if they all understood.
yeah,
as it was.
is we're going to have a little discussion. Did you all get to watch the video and do you understand so far the information that, yeah, so the two kinds of ACL rupture, meniscus or ACL? Because there's two kinds of meniscus rupture, the meniscus, the two donuts. There's just a regular meniscus tear and the bigger, more serious one called the bucket handle tear. So it's the bucket handle tear wherein the tear is more severe and goes into the part of the meniscus where the blood supply is not present. Okay. So what I want to do now, first of all, is answer any of the questions you have about the anatomy of the knee. And any questions you have about kinesiology. after I answer your questions, we're going to go through each of these injuries and we're going to see how to manage it in a yoga class. Okay, but first, I need to know that you have a good idea about the technicalities of these injuries and the parts of the knee that are effective. So does anyone have any questions about any of the injuries that we saw in the video?
Pee-wee.
Yes. Lisa.
Good morning. Yes, good morning. I have a question because I have a tendency to actually lock my knees, and especially in triangle position in Trikonasana.
Lisa, you have a,
yes,
you have a question, or are you just unmuted?
No, I have a question. Can you hear me?
Some of your mics are not working. So if some of your mics are not working, Lisa, we cannot hear you. So if you can just maybe either turn on your mic or ask a question.
I can hear Lisa as well.
Let me check my
Yeah,
speakers.
and I
Can you hear me now?
You can hear
They're
me.
on, no? Yeah.
Pee-wee, do you hear me now?
Everyone can hear Lisa except me.
Ah.
She's not muted. I don't know at this moment. Maybe she can write to them.
Okay, just type it down, Lisa. Everyone can hear Lisa.
If everybody can
I
help
maybe
me,
change
I'm
headphones?
locking
Is it
my
the
back
headphones?
knee.
No. Can someone talk to me so I can see if the headphones are working?
Yeah.
Hi, Pee-wee, can you
Hello,
hear?
PV.
I can't hear anyone. Okay, 1 second, 1 second.
Hello, hello. Can you hear me?
Can you hear them now?
Okay, someone talk again.
Pee-wee.
I think.
Pee-wee.
Okay, someone say something.
Pee-wee.
Yeah, we are your fans.
Ah,
Let's continue.
okay, no.
No, she
Back knee
doesn't
locked
hear.
up or triangle. Easy to unlock front leg. Back leg is not easy for me to release. Okay. All right, so your knees lock up during triangle. Okay. So if the knee is locking up during triangle, it may possibly mean that you're going past 180 degrees in the angle of your thigh. And that's why the kneecap moves and you cannot put it back. So what you want to do is keep your knees slightly bent when you do the triangle. For you, it might seem like really bent, but actually they might be just straight. Usually the knee locks when the patella slides, and the reason why the patella slides is because your knee goes past 180-degree angle. So the solution is to bend the knee. Okay. From Nasima, I have little pain sometimes on the lateral collateral ligament. Is it from lotus? So usually when you have a tight hip in lotus and your knee cannot externally rotate enough, the knee starts to externally rotate. Okay, so if the knee isn't in, and I think that it could be from the lotus, so what you need to do is check to see how much you can externally rotate your thigh, because that might tell you if you're compensating from the knee. Okay, so what I'm going to do now is I'm going to test to see how much Nord can externally rotate his thigh so that we can talk about rotation of the knee in lotus. and then we'll talk about rotation of the knee in Virasana. So Nasima, for you, I would have to say yes, it's probably lotus. So let me just show you. So right now, I'm just going to pull the chair back a little bit. Nord's going to sit in the chair. And those of you that graduated from my 200 hour, you will probably be able to see this as a review. How do you do full screen? Oh, shit. Okay. There you go. Okay. I think that's good. Can we drop the camera a little bit? Here we go. Okay. No, just sitting. Just sit. Okay. So let's test to see how much he can rotate his thigh. Okay. So I'm going to just have him flex his foot. Okay. And then I'm going to just take his leg and start to roll it outwards until I cannot roll it outwards anymore. If I roll him out too much, he'll start to lift his other hip off the floor. That means that he's reached his limit. Right now, I cannot roll his thigh outward any more than this. So his knee and his ankle are quite far away from each other. If I were to force his foot to go above his knee to get into the lotus position, where would the movement be coming from? His thigh can't do it. So where would the movement be coming from? His knee. His knee would have to rotate externally. And this is external rotation of the knee. And right now, I'd say he has naturally around 2 degrees of external rotation. See, there's not much. Look at his foot. That's all the external rotation he's got. So if his leg can only go this far, and I give him more than 2 degrees of external rotation in the knee, I will probably hurt his knee. In particular, the rotating structure inside, and I might also have an effect on the lateral collateral ligament because this guy keeps the lower leg from sliding outward. And when I do this and I try to force into lotus, I am in fact getting the lower leg to slide outwards. And therefore, I might injure my lateral collateral ligament, but I also might injure my ACL or PCL because those are the ones that keep you from twisting. Okay? But the same going the other way in Virasana. So now I'm going to test internal rotation. So let's see how much his thigh can roll in. So I grab his foot and I start to roll his leg, and that's it. So for him to sit between his heels and get the foot here, that movement again will come from the knee, but this time the damage will be in the inside. Okay, so the damage will be in the inside because the MCL keeps the leg from sliding that way. And if I do this and I keep forcing his foot to where his thigh won't go, then in fact, I am causing damage to the medial collateral ligament of his knee. Okay. Which means that if I have a little bit of a restriction in the femur, then my best friends are blocks, so that I'm not going to hurt my knee, and instead I can work with the range of my femur without any rotation. Lucky for some of us, we have a little bit more rotation in the knee. This is my right knee. I have a hypermobile right knee. So maybe I have around 20 degrees of rotation in my right knee. My left knee, however, only has maybe 15. Okay, so sometimes our knees don't have the same amount of rotation. Okay, let's look at the questions.
Can you hear with this?
Can you hear me, guys?
They can hear you.
But someone talk. Say hi.
Hello.
Hi.
Okay. Yes, I can hear them.
Hello?
Let's just return these things. Just return them.
But this
Or let's
college,
just sell them to some other sucker. Okay.
it's just it's my college.
All right. Okay. So
It was a
O
good
is
college.
saying,
But
what
now
is
he's
it when
working
I sit for a long time
supervisor at wellness group.
in one pose, not in yoga?
What is wellness group?
Lisa, can you mute your mic? Thank you. Okay. What is it when I sit for long in one pose, not in yoga? Like sit long hours on the plane. And when I want to change position or straighten legs, it's painful in the knee. In the plane, we have something called blood pooling. When all your circulation goes down into your lower body and causes swelling in your joints. And that's why in the plane, you haven't moved for a long time and you have blood pooling in your lower joints. And then it's hard to move your joints when you start moving again. So that's why it's really important to actually either massage your legs or move around when you're in the plane and not stay in one place. Okay, Ashley, during up dog or lizard, on back toes with back leg straight, back knee hurts despite long, strong quads. Is the only solution to do the pose with knees down. Okay, so the back knee hurts during lizard. Okay, your leg is straight and your knee is hurting, even though your quadriceps are contracting. That may mean that there's a little bit of A, movement between the tibia and the femur, or B, you're hyperextending. So one thing you might try to do is soften the knee to see if the pain goes away. If the pain does not go away, you need to put your knee down. Or you can put a block underneath your thigh or knee to support the thigh. So if you're going to do a lizard, you can try putting a cushion, a bolster, or block underneath the back thigh. Okay, Yute, do you have any tips on strengthening the medial collateral ligament? Okay, good question. Remember, these are ligaments, and when they're loose, there's nothing we can do about them. They're like rubber bands. There are no muscles attached to them. Therefore, when you loosen them by repetitive strain movement, usually the only way that you can retighten them is with like ice therapy, cryotherapy. That will knit them back together. But what we can do in the meantime is strengthen our inner thighs. When you strengthen your inner thighs, and some of the inner thigh group go all the way down to here. Okay, when you strengthen your inner thighs, you're in fact strengthening the area of the medial collateral ligament. And aside from the inner thigh, this part of your hamstring, this is your biceps femoris. Strengthen your biceps femoris, strengthen your inner thigh, and that's actually going to have a ripple effect on your MCL. Okay. So that means squeeze a block between your legs, contract the hamstring. Okay, Lisa, Pee-wee, does that mean that ice bath really reshape ligaments and give them back to recover? Yes, exactly. It's another thing to put on your ice bath ad. That ice is the only thing that heals ligaments. If you have loose ligaments or injuries in the ligaments, ice therapy is the way to heal.
Yes, and if I may add, the Peewee ice acts like an anti-inflammatory on the ligaments, on the tendons, even on any injury.
Yeah. Okay. Awesome. Okay. Yeah. Yes. Okay. Carla has an ice pack collection. I'd like to see it. Okay. Yeah. Is it possible that children's bones form according to repeated ways of sitting, causing lifelong restrictions? Okay. This is a good question because a lot of teachers in school have this as a concern. Here's the thing. Everyone is born with some kind of hip position. Some people are born with internally rotated predisposed femurs. Some people are born with externally rotated predisposed femurs. And I'm gonna remove this for a while so I can explain. If you get the child to sit down, they're going to choose what is easier for them to do. You know, kids are very smart. They're not going to put their body in a painful position. If they feel any pain, they're just not going to do it. Kids are smart. They're not stupid. Sometimes they're smarter than us because we listen to other people. Kids listen to their bodies. So if you've got a kid with a predisposition for external rotation of the femur, depending on the specific way that their thigh fits in the socket, and you tell them to sit, automatically they're going to do this. Or sometimes they'll do this. And you will see that, bang, they're on the ground. Now, some people, some kids, have an internally rotated predisposition. For those kids, and I'm not one of them, that's why I'm just going to grab a cushion. For those kids, if you just tell them sit down and you don't give them any instruction, they're naturally going to do this. Because it's easy for them to do. If you make these kids sit this way, you'll see them go like this. Because they can't do it. That's why they're sitting this way. Because it's easy. They don't sit this way because it's hard. If you force a kid that can do this to do this, that's not going to improve that. Because your bone structure does not really change. Even if they're kids, the situation of their femurs in the sockets are already set. But I'd like to say, what's wrong with the kid sitting with the thighs rolled in? What's wrong with that? What you want to do now is just check and make sure they're using their feet correctly. So instead of looking at this, let's look down here. Because even someone with an internally rotated predisposition, if you teach them how to use their feet properly when they're walking, the knees will be fine. They'll grow up to be fine adults. They won't have a problem. If you make someone sit this way and they're made to sit that way, that might even have issues. So I think that we can't force all the kids to sit this way because some kids are just never going to be good at it. It's like forcing all kids to do math. Some kids will never be good at it, ever, no matter how much math you shove down their throats. Okay. So what does Carla say? Carla is a kids yoga expert. She trains kids yoga teachers. So maybe you can illuminate us with that. You often come across these kids in classes. At times, this can be a sign of scoliosis. You have to check the spine. Okay, so sometimes they can't sit properly because of the spine. Okay.
Yeah, it happens.
Yeah.
I'll just top up that.
Yeah.
Yeah, it can happen, and they just kind of sit in knock-kneed, so what they call in schools in a W shape. And it's actually quite painful for the kid to sit down in a Peter Pan shape, which is yoga's easy pose. So if that happens, I always recommend they have a little bit of a look at the spine with their pediatric. It's not always the case, but it's often the case. So, you know, if they identify scoliosis at the age of 5 or 6, it's actually quite beneficial in the long run for that child's life, of course. Yep. Weakness in general, very weak legs.
Yeah.
Can also cause that they sit like that. That's what I'd say.
Okay, thanks, Carla.
You're welcome.
Okay, so Can knock knees or bow legs be fixed? As in, if you work with the hips, you can lessen the effect of the angle. Here's the thing with bones. If they've grown in that shape, you cannot change the shape of your bones. But if there's pain in ACL, PCL, or MCL or LCL, then you can do something about it by strengthening your muscles. However, if the bone has already grown in a sort of deformed shape, you can't really change that anymore. Okay. So,
Can I say about my knees? It's okay?
yes, Rita. Yes, please. Okay, share.
My hip is so tight, very, very tight, and still tight after 4 years of yoga. It's still. So
Okay.
when I did the Ashtanga, so the teacher was like forcing me to do lotus. This is why all the inflammation, I still have inflammation in my tendons. It's not injury, it's inflammation. So any kind of movement hurts my knee from here, from the inner side and outer side, both of them.
Okay.
And even
both
from
the inner and outer sides.
Yes,
wait,
and
let me look for. Okay.
From here.
Yeah, there you are.
Yes.
Yeah. Bring the camera down so I can see your knee.
Yes.
Okay. Okay. Yeah. Okay.
And even here.
Okay.
So now, if
right.
I want to sleep, I have to put cushion inside my knees in able to sleep. This is 2 or 3 years, but still.
Wow. Okay, due to maybe too much rotation. So it sounds like your thigh wasn't ready to external rotate like I did to Nord, and then the teacher rotated you externally, which probably had an issue. Have you ever checked with the doctor to see exactly what the issue was?
Yes, I went, and they do a lot of things, an X-ray. It was tendons inflammation.
Okay. Okay, tendinitis or something.
Yes.
Okay. It sounds like all over your knee.
Yes, all over from
That's
the
like
and sides, exactly.
Wow. So it's the rectus femoris tendon, it's the MCL, and it's the LCL.
Yes, because I did it maybe for 2 months. She told me it's better for the hip. Ashtanga is better. So I went for Ashtanga for 2 or 3 months, and it was a mess.
Oh no, yeah, because instead of your hip, you ended up with a knee. Okay. So what can we do for that? Okay. So first of all, if you want to rehabilitate this front part of the knee, the best thing you could do is strengthen this quadricep muscle. Do maybe weight training on the quadricep, put the weight on your ankle and extend the knee, straighten the knee. Or you can straighten your leg in sitting position and then contract the thigh. So if you contract the thigh, that kind of pulls the tendon and actually strengthens the tendon and the knee. So work on this muscle, make it stronger. Okay? Now, for the inflammation of the 2 ligaments in the side, as I was mentioning before, that we really can't make them better without using ice. Okay, so kind of ice therapy is a great way to rehabilitate the ligaments on the sides. Unfortunately, those ligaments have no muscles attached to them. If you strengthen your inner thighs and you do a little bit of strength training in your abductors, that might help to keep the area stable, but to reduce swelling, and if there's still swelling here, the really best thing to do is use ice. And that would be maybe 45 minutes of ice therapy. If you just put the bag of ice around your knee and just keep it there for 45 minutes. Okay? Or if you ever go to Dubai, contact Lisa and she'll give you an ice challenge.
I'm organizing one next week, maybe.
Oh, there you go. Okay, so if you're not in lockdown still in Jordan, you can go to Dubai and organize an ice. She does Lisa does the Wim Hof method, which is the way which you strengthen your body's resistance to cold and The breath techniques are really helpful in rewiring your body so that it's actually really beneficial therapy for ligament injuries. Okay.
Thank you, Pee-wee.
You're welcome. Okay. I noticed bow legs are more common in Asian people, whereas knock knees are more common in Europeans. I wonder if there's anything to do with floor sitting in Asia. Any thoughts? Okay. You know what's interesting is bow legs are common in Japanese, but they sit in Virasana. So that kind of, if the sitting position was going to give them any kind of issue later on, it would be knock knees. But the reality of Japan is a lot of people have bow legs there. So I don't think that it's got anything to do with sitting position. I think that having bow legs could be a genetic thing. Usually it's genetic. How can yoga teacher force someone into a painful position? Yeah, you know, it's, don't blame the yoga teacher. Blame the person that trained them. You know, don't blame the yoga teacher. They're just trying their best. You know, but sometimes if you're not given the right information, then that's on the person that trained you. Okay. Well, in Thailand, mother hold their kid riding. Yeah, okay. Maybe. Because they hold their kid here, right? Or here on the side, like riding around like that. And maybe it makes you bow-legged. It could be that. That sounds like a more likely culprit because in Asia, people don't sit down as much. There's too much to do. So it's probably the way that mom straps the baby to her. That I think makes sense. That makes a lot of sense. Thanks. So, okay. So now let's go through what to do for different kinds of injuries in a yoga class. Okay, so the first thing that we're going to look at is the quadricep tendon injury. Okay, let's say they injured the quadricep tendon, they went to a doctor, they got the therapy or they got an operation or something happened, but now they're okay to work out already. And so now you want to rehabilitate, and Ruba, this is for you. You want to rehabilitate this area. What are the kind of things we can do? What are the kind of asanas you can put in the person's class to be able to help them with this area? So let's go through that really quickly. The most advisable movement for someone with this kind of injury, once they are already rehabilitated, so you are not going to rehabilitate them, you are not a doctor, but when the doctor says that you're okay to work out, this is when we can help, okay? So again, we are not doctors. You can't rehabilitate someone with these injuries. You can only help them once they're okay to move. So when you're balancing on one leg and you go to Utthita Hasta Padasana, to make this movement and floint the foot. Okay, so inhale, exhale, and you can do this a few times going into the floint. And if this is too difficult, chances are they're going to be down here. So you start really low, and as they get better at it, they'll be able to be stronger and be able to lift the knee a little higher and a little higher. Remember, you're flointing the foot because flointing the foot is going to keep the integrity in the knee joint. Okay, so that's one thing. Another thing you can do is extend the legs in Dandasana and pull the kneecaps up. So contracting the quadricep femoris to make this tense. Kneecap will drop and flatten and move upwards. So putting the hands behind, inhale to prepare, exhale, squeeze and hold, 4, 3, 2, release. Again, you may floint the feet. You can even push the feet against the wall. So if you have a wall, you can sit against the wall, push the feet against the wall like we did yesterday. Inhale, and exhale, pull the kneecaps as you push the feet against the wall. That's going to also floint the foot and contract the other parts of the knee. What we don't want to do is hyperextend. So when you do that, you don't want your heels to lift off the floor like that. So we're not trying to go into hyperextension. The heels stay on the ground, and you're just contracting the quadricep without hyperextending the knee. So that's really important. So you inhale to prepare, and as you exhale, you pull the kneecaps, contracting the quads, hold it for a few seconds, release, and then relax, and then you do it again. Trying to make sure to keep your feet in an even floint and not let the heels come off the ground. So that's the second thing that we can do for a quadricep injury. And most importantly, any standing pose that this person does, micro bend, contract the quads. So you're going to a triangle. Micro bend, contract the quads. You're going into a standing balance. Micro bend, contract the quads. So a great way to learn how to micro bend and contract the quads, once again, is to train yourself against a wall. Micro bend, contract the quads, push your feet against the floor, which is the wall now. So push your feet against the wall, hold it for a few seconds, and release. Then the other side, or both feet together, micro bend, contract the quads at the same time, pressing all your toes and your whole foot and keeping the four corners down. So watch the position of your ankle against the wall. So training yourself to stand properly again against the wall is a really great way to learn how to reposition the way you move your leg. So Ruba, I'm thinking that the reason why there's still swelling after all this time is that we need to relearn how to use our thighs and knees again in a yoga workout, so you don't end up aggravating whatever is inflamed. Okay?
It's not swelling, it's painful.
Yeah. Yeah, that usually pain is due to swelling. Usually. Okay? Yeah. Okay. So you can try that. Yes. Yes.
When you were sitting and extending your leg, I observed that there was hardly any gap underneath your knees.
Yeah.
And my
because my knee hyperextends. See the angle on that knee? That's not natural. That's a hyperextended knee. That's why there's no gap. See that? Because this is 180 degrees. That's a normal knee. This is past 180. So look, my kneecap moves. Can you see that?
Yeah.
Because I'm hyperextending. This knee, especially my right knee, ever since I was a kid, this knee is too flexible. That my kneecap used to get stuck. So don't look at my knee as a role model. This knee is actually not a role model. Okay, so remember, this is 180. Kneecap is not loose. This is hyperextend. Kneecap is loose. Okay, that's why there's no gap between my leg and the floor. But a normal knee will have a gap between the knee and the floor.
Oh, okay.
Okay?
I thought I was not normal.
No, I'm not normal.
Okay.
Can I ask something about the positioning of the and feet?
Yes.
Combine both things yesterday and today. We always say keep the outside of your feet parallel in Tadasana. Then when we are in Dandasana also, keep your kneecaps pointing to the ceiling. Then the feet can go apart. So we are all different. So somebody's knees go inside, more outside. What is the best way to keep feet, knees, our tibia femur in a healthy way?
Okay, yeah. the first guy I would look at before the feet is the position of the knee. The second thing I would look at is trying to make the position of the knee and the inner line of the foot. So I actually stopped using the side of the foot simply because everyone's foot is differently shaped. So I got these tattoos done last year because this is what you want to line up with your mat, the center line of your foot. Because we have different shaped feet. This is not reliable to use. If I line up the center, the outside of my foot with my mat, I'm going to end up a little bit rolled in. But if I look at this inner line of my foot from my second and third toe to my inner heel, if I use that as a reference and line those up forward, and if I want to do parallel legs, then I line up the center line of my foot. It doesn't matter what my foot shape is, because the important thing is that my feet line up. This center line of the foot, you make it parallel. So this is actually my Tadasana. Because I used to have bunions, I really can't get the feet together without hurting my foot. But I can make these two lines parallel. And if I do that, my knees are pointing forward. If my knees aren't pointing forward, but my feet are pointing forward, then the next place to look is actually the hip. So in that case, what you want to do is either externally rotate, or, yeah, the first one is better. Internally rotate until you get the knees where you need them. Okay, so you would adjust from here. So I hope that's answered your question. So it's not just one part of the body that needs to realign.
Yeah.
Usually it's a combined effort of your thigh, knee, and the center line of your foot, which is more reliable than using the sides of your foot.
Yeah. I also stepped away from what I learned because it doesn't work in reality. It's a nice.
No, because
it doesn't.
Yeah, you know it.
Like your hands in downward dog. When you say keep these two more or less pointing forward, it's the same with the feet. You know, then you are well aligned. That's my opinion.
Yeah. So looking at like maybe the inner portion rather than looking at the sides. The thing with the feet is also people have different shaped feet, and I stopped using the outer edges of your feet and even that big toe together, heel together. Not everyone can do it, especially if you're a woman, because we are sexy. And it doesn't feel good to put the feet together. We need more room. Because your back sometimes hurts if you put the feet together too much. Some people's backs will hurt. Because your pelvis is not meant to be mashed together like that. Okay. Yeah, and you know the whole point of yoga, I think what's been lost in the last few years in yoga, what's been lost is the understanding that bodies are unique. Individuals are unique. They're in unique journeys. We won't all feel it the same way. We won't all feel yoga the same. Our experience of the pose is never the same. So why are we trying to standardize everyone? Let's just become more anatomically aware so that we can see the beauty of everyone as unique individuals and be able to respond to them in an educated way. So this, I think, for me, is more important than getting everyone to look the same. Okay. So that was the quadricep tendon injury. Now let's go into the meniscus, the ACL, because ACL is a really common injury that a lot of people have. So remember, in an ACL injury, this is the tibia is able to slide forward. It slides forward. That means that you need to be careful with any leg position that might cause the tibia to slide forward. Okay, and the leg positions that might make the tibia slide forward basically is any position where the leg is in this position. The tibia is going to slide forward simply because of gravity. So any position like that is probably not going to be good for someone with an ACL injury, simply because of the position of the leg. So I'm never going to get them to raise their leg in locust. I'm going to have them keep their legs down and just lift their upper body instead, because the tibia is sliding forward in that position. But the most important thing about the ACL injury is controlling the sliding forward of the tibia that might accidentally happen during standing warrior poses. So if you've got someone with an ACL injury in this pose, first of all, you can't go too far. Okay? Because the moment you hit a certain angle right there, the tibia may start to have a little bit of front movement. The one that's preventing that front movement from happening is the quadricep and the hamstring. So if someone with an ACL tear goes into a warrior, first of all, they're not going to go all the way down. They'll only do a little. And then you have to contract the back of your leg and the front of your thigh to make up for the ACL. Okay, and depending on how strong your quadriceps and hamstrings are, that much deeper you can go. So again, for an ACL, anyone with an ACL, strengthen and use the hamstring and quadricep when you do any kind of warrior. Okay? And another thing you don't want to do with ACL is external rotation, because or internal rotation. So any kind of rotation is probably not going to feel good, because the stabilization of your knee is not that good anymore. And if they're feeling a little bit of a discomfort with the ACL, then they could use a block and just keep the leg from rotating by putting the whole entire thigh and leg situation on the block. So you're not just hanging it like this. You need to also support the knee itself like that. Okay, so one thing you might need to do with someone, especially if their hips are tight, if their hips are not tight, they can boom, go on the ground, and everything will be fine. But if they're hanging somewhere in between, you probably need to give them a little bit of support to keep any excess movement in the shin bone from happening. Okay, and if you're going to go the other way, again, you might need to prop yourself up and make sure that there's no excess movement in the knee joint. Okay, no excess movement, meaning you're supporting either the inner or outer side of the knee when you do any kind of internal or external rotation. Okay, and finally, what you might need to do is prop the knees up. Prop the knees up. But make sure, don't just put it on the thigh. If you're going to prop the knee up, you've got to support also the top edge of the tibia. Okay, support the top edge of the tibia so that there's no extra movement. Okay, that's it. So supporting the knees in all poses, especially if they feel a little unstable. Okay, but that depends also on the person's structure. So some people might feel just completely okay here anyway, their leg is on the floor and everything is fine. Okay, but if they feel any discomfort, then you would prop up the knees like this and support the top of the tibia and the bottom of the femur. Okay, for a PCL, it's the opposite. So for a PCL person, when you lift the leg like this, the tibia actually slides backwards. So it's the opposite. The rotation is the same, but the opposite is that movements that cause you to do this is probably not that advisable, okay? Because of the fact that the tibia slides backwards. Definitely, we don't want to be doing that, and we also want to prop up the leg like this. Rotation would be the same, okay? And again, in the warriors, so to prevent the backward slide of the tibia, what needs to happen more is the quadriceps need to strengthen. Although also using the hamstring muscle. So quadriceps and hamstring muscles to keep the leg supported. So ACL and PCL are almost the same in what you need to do to keep someone safe with those injuries. Okay, so what I'm gonna do now is I'm gonna put the headphones on. And you know, if you do have these injuries, please feel free to share your experience or to ask any questions. So who would like to share or ask a question? You can type it or you can just go ahead and unmute yourself. Munira, yes.
I don't know if it is related to ACL or PCL, but I just want to ask you something. You know my problems very well. And in a long time, I have been having a pain on my right side over here.
Mm-hmm.
And once you fixed me by doing this, and then this pain is recurring. And also used to have a pain like shooting pain coming up from here and catching me at my pelvic area for split seconds.
Okay.
So
okay.
initially it was diagnosed that I have got some urine infection, and tests were done and I was treated several times. But then just last month I had urine infection, and then again after a few days this thing occurred. So I went to a doctor and I said, how can urine infection happen again and again, because my liquid consumption is pretty good. And if one day or so, if I have a little less consumption, doesn't mean that I should get that cramp. So he's telling me that I have some nerve compression over here. Some nerve is being pressed, and for which I should avoid flexion, and he's given me medication for nerves.
I will tell you what it is. So yeah, there is a nerve being pinched, and it's probably your sciatic nerve. And the sciatic nerve is being pinched by the piriformis muscle. The piriformis muscle runs from here to here through your hip. That's why sometimes the pain is here and sometimes the pain is here, right? So sometimes you get some kind of pain inside here, and sometimes you're going to feel it inside to here. So that's the piriformis muscle that runs through your hip bone. And it connects. So where I pressed you last time is here. So here is where you might have felt the pain. In Iggy, you have the same pain that Munira has. So you can tell Iggy, you both live in, you know, Iggy lives in Mirdif, you live in Alwarca. She can come down. Oh, you moved to Silicon. Oh no. Yeah. You're not my ex-neighbor anymore. Okay.
Yeah, sadly.
Okay. So that's a piriformis, and you can release it easily by pressing. If you're able to put a ball there, or someone will take their knuckle, or you use your knuckle and you push into where it's tight. You can feel where it's tight and you press into it, because that's going to loosen up. That muscle runs through the inside of your hip.
Okay.
It's not on the outside. That's why you'll get the shooting pain traveling either in the back side or towards the front side.
No,
because the muscle goes through your hip.
It like actually, you know, disables me. It catches my pelvic area for a few seconds while I'm walking.
Yes, exactly, because the piriformis is the hip flexor. The piriformis helps to, not hip flexor, but it does this to your thigh. The piriformis does this to your thigh. So this is the movement of contracting the piriformis. So sometimes when we walk, there might be a little catch somewhere.
Okay.
Because it's very stiff. So again, it runs through your thigh from here to here.
Yeah.
So it's a little bit tricky because it's inside your body. But stretching your buttocks will help to release the piriformis. So you know how you do this stretch like this, where you take the leg to the thigh like that.
Yeah.
And you pull it in. And then you can go into a eagle twist and take your hand and just kind of massage this area here.
Okay.
And that's going to at least help to loosen up the muscles that are in that area, and that might help.
Okay.
Okay.
Thank you so much.
Okay. You're welcome. Anyone else have any questions?
Yes, Pee-wee, is it safe for knee problem to have poses on the knee, like cat-cow?
Yeah, okay. Okay, yeah. If the tendon injury, if it's a tendon injury here, it might be very uncomfortable for them to go on their knees because that tendon is weak or loose. So it might be advisable to just avoid going on the knees or putting padding under the knees if it helps. Otherwise, just avoid it because it's uncomfortable. Okay. For ACL and PCL, it might not feel comfortable also if there's a little bit of a sliding to get to the position might be uncomfortable. Okay, for ACL and PCL also. Yeah, Yute.
I have got a problem in getting into goddess pose because my knees are crackling and very loud when I move them up and down. It's very scary. And I noticed now when we did the training, when you said point the feet out, it's nicer for my knees, but everybody told me before to keep the feet forward. So feet forward and then go into the pose. This is
that is just ridiculous. I don't know why. You know, you're rotating your knee, you can feel it, right? Because the foot is facing forward and the knee is rolling out to the side. I mean, that's just ridiculous. I mean, I think that the knee and the foot really need to agree which way they're going. Yeah. So as much as you're externally rotating your thigh and where your knee is pointing, you really have to line up your feet with them.
Yeah, it's like Malasana.
Yeah. Yeah, like Malasana. I mean, you don't do Malasana with the feet forward because you're going to twist your knee. So it's pretty much the same thing.
Yeah, thank you. I just have this confirmation.
Yeah. Okay. Let's get through some questions here. What about old people knees that hurt due to arthritis or old age? Can they lean on knees? Okay. Depending on the type of arthritis and how it's occurring, if it's swelling or kind of you know, the joint is starting to disfigure, that's going to determine what the range of motion in the knee is possible, and you'll just have to work with whatever the comfortable range is for them. So can they lean on the knees? Well, first of all, it depends on how strong their muscles are and the range of motion in their knee. So two items. Check how much mobility they have in the joint, and then check how strong they are in the muscles surrounding the joint, the front thigh, the sides of the thigh, the back of the thigh. And that's going to give you an idea of what kind of modifications that you're going to. Usually when you're working with like a senior, yoga is very, very, very small and supported. On a chair, against the wall, hands on the table. And depending on the range of motion, you're going to work the joint. Okay. Does anyone have anything to say more about this? We're talking about old people's knees. Okay. Nasima. Yes, yes.
I think I'm a good example. And it's just up to you how you make the motions.
Yeah.
Bending, stretching, you have to keep practicing and get into that mood.
Yeah. But it's also like you just have to keep moving. Usually it's a lack of movement that leads to this issue. And Munira is lucky to have been training herself for a long time and moving her body. Yes?
Yeah, and actually many doctors advise people not to sit down and bend their knees and sit up on the chair, and I think that's the worst thing to do, because as you grow old, if you stop using any of your joints, it just freezes.
Yes, I agree with that. So whatever range of motion is available to them, they should do.
Yeah.
Because the day might come when they can no longer do that. So enjoy what you can do while you can do it. Do it as much as you can so to prevent any further deterioration.
Kiwi?
Yeah.
May I add something?
Yes, I was waiting for you.
No, I was waiting for everybody to finish. No, because I would like to add that, especially for people with arthritis, wearing a knee protection is super important, even if the doctor says you don't need it, because unconsciously, you have your knee supported, and you are, sometimes we are high achievers and we think that we're fine, we don't have pain today, so we go forward. But when you have the knee protection, you look at your knee and you feel the elastic thing on your knee, and then you would say, oh yeah, I have an injury, so let me take it slower.
So you have to be mindful. Yeah. So if we can put Munira and Rita together, then you've got it. Because you do need to be aware. You do need to be aware, and you need to be mindful, and you need to listen to your body. At the same time, you need to also continue to do what you can. Continue to do what you can. Continue to the beautiful thing about Munira, she doesn't listen to her doctor.
Yes, because this is the first thing that the doctor tells you, like, don't exercise, just don't take your medicine and go to bed and sit in bed and don't move. And
yeah, exactly.
if you do that, you deteriorate, of course, but you will be depending on medications by the end of it.
Rita, I have arthritis for the past 44 years.
Wow. Wow.
When did it start? Can you share? When did it start? What age?
1978, a week before.
How old were you? How old were you?
21. And I was like, I couldn't move myself. My legs were all stiff and frozen. And I was in a very small village in India where no doctors could diagnose what was wrong with me. And then I was given a high dosage of penicillin or something. And as a bride, I had all the bandages around my legs and knees, and then I went in for my ceremony. But after marriage, I was put into bed for 6 months after I came back to Bombay, and the doctor said, you got rheumatoid arthritis. And he said, if you do not take bed rest, your heart valve gets spoiled, and which is not repairable.
Yeah, Munira,
it's not even true.
Sorry, now we maybe we went out of subject here, but rheumatoid arthritis, it's not only that it's not repairable, but you can live better with it. Get in contact with me and I'll give you a list of things that you can do, and it will relieve lots of pain, and it will put you off medication slowly. Just
I
so
take no medication right now.
Sorry?
I'm not on any medication for many, many years, ever since I started yoga.
Yeah, perfect.
And I initially, yes, I used to take almost 8 disciplines a day.
Wow.
Until 94. And then when I started yoga, I gradually gave up all the medication.
Yeah, that's perfect. So anyway, anytime you want, you can get in contact with me, and if
yes,
I help you, I would love to.
Yes, definitely.
Okay, so Debbie is also sharing that she said arthritis for about 30 years, and she agrees with listening to your bodies. Nasima, my younger sister, had a horse riding accident and fell on her knee 2 years ago. She had 4-hour surgery with iliac bone transplant and a plate. She's trying yoga, but it's very difficult. She can't bend the knee at all. Okay. Yeah, it sounds like she had some sort of procedure in her knee where her knee can't bend. It could be scar tissue. Depending on where the scar tissue is, I'm thinking maybe it might be in the back of the knee, or some kind of procedure that they did that prevents her from being able to flex the knee. So what you want to do first is check if there's any scar tissue preventing her from bending the knee. Maybe instead of going into a class of yoga, what you should do is the joint mobility exercises for the lower body. Rotating the ankles, contracting the quads, trying to internal rotate the thigh, go into rotation first, and if there's scar tissue in the back of the knee, you want to try to massage and break out the scar tissue. So it's going to be very difficult to get someone who had knee surgery and who cannot bend the knee into a normal yoga class. But a private session most probably will be something that they would go for. Rheumatoid arthritis due to wrong food when I moved from Asia to Europe. Wow. Yeah, anti-inflammatory foods. Super. Okay, so that was ACL, PCL. Now let's just talk a little bit about medial collateral ligament and lateral collateral ligament. So you've got MCL and LCL. So again, the MCL on the inside of your leg and the LCL on the outside of your leg are not attached to any muscles. So the issue with MCL and LCL is the only thing we can do to stabilize the knee. A, don't rotate the knee. B, don't put any excessive force on the tibia to the outside or inside. Okay? That means that when they stand, you want to make sure that the stance of the person is always hip width apart. If you have MCL issue, this might be a problem. Okay? Because there's force on the inside of your leg. So this will probably be a little better, okay, than doing this. And so if you want to stand and you have medial collateral ligament, the inside one, you want to just keep the feet hip width apart at all times. Okay, that means in any standing pose, it's hip width apart. And the thing with the MCL is this internally rotated foot in the Warrior One, that's not a good idea because you're putting a lot of strain on the MCL. So anything that causes force on the inner part of the leg is not advisable. So Warrior One, throw it away. Warrior Two, throw it away. So all these movements, that's going to put a lot of strain here until you strengthen the inner thighs. So this work is essential. And this work is essential. Any strengthening movement of the inner thighs is essential, so that once that is done, they will be able to do the normal stuff that everyone else can do in a yoga class because their inner thighs, quadriceps, and hamstrings are strong. And you keep them contracted when you do the poses. But before that time, just avoid anything that puts strain on the inner part of the leg. Okay, so you're better off just doing these standing balances. This can be, okay, strain on the inner part of the leg. If I push like this, I'm putting strain on the outer part of the leg, so that's okay. Okay? But this is not okay because, again, strain on the inner part of the leg. Okay, so no warriors. Stand with the feet hip width apart. External rotation is okay. Internal rotation, not okay. So if I've got MCL, I can go into Baddha Konasana, but I cannot go the other way into Trianga Mukha. If I'm going to do Trianga Mukha, I really have to support this. But I'm better off avoiding it because I don't need to stretch that. I need to contract it. Okay, I need to contract it. Gomukhasana is better for me. That one is not going to hurt me. But Virasana is going to hurt me. So I'm going to stay away from this pose. This is okay. Okay, internal rotation, not okay. All right, so stabilizing the knee by putting a block and squeezing the inner thigh and making sure the knees and the toes are aligned when I do any kind of pose, keeping the feet hip width apart. This is okay, and in fact will help me to strengthen my inner thigh. So this is completely okay. I'm using the block as a spacer. I'm using it to help support my lack of MCL stability. Okay. So that's MCL. LCL is the opposite. So in LCL, you don't want any force going outward, which means that this is okay. This is not okay. Okay, so if it's LCL, you don't want any force on the outer. So you actually want to step a little wider than hip width for LCL so that there's no strain here on the outside of the knee. Warriors, okay. Okay, warriors, okay. Eagle, not okay. Okay, all right, so tree pose, not okay, because the force is going into the outer side of the knee. So anything with the feet wider than the hips is fine. Goddess pose, okay. Warrior 2, okay. Warrior 1, I'm actually going to step out wider than I need to. Okay, then that way the force will go in and not to the outer. So I'm actually this wide. Okay, and that's going to keep this part of my knee feeling happy because there's no force on it. Which means that hip openers, not okay. Seated hip openers, not okay because the force is going here. So if I'm going to do a seated hip opener for any reason, I'm just going to prop up this whole entire system. I'm going to put the block underneath both the tibia and the femur. What is okay is internal rotation. So this is okay. This is not okay. I need to prop or just don't do it if it's still uncomfortable. Okay. So that was MCL and PCL. I believe there's someone here with a, does someone here have an MCL injury? Okay. Let's see what people are saying. How do you check if there is scar tissue? In general, not necessary to a specific area of the body. Is it possible, or is identifying scar tissue an area-specific exercise? Usually, scar tissue is in a specific area of the body. Scar tissue is something that happens after an injury. If you palpate the area, first of all, there's lack of mobility. And second of all, if you palpate the area, it's very hard. Okay? And scar tissue feels a little bit different than just normal muscle. It feels a little bit different. It's a little bit like brittle. Many doctors say it's not safe to sit on shins, so the body weight will not be affecting the knees. Depends on, for Ruba, for which knee issue or all the knee issues?
I guess all, like body weight shouldn't be on the knee in general.
Okay. yes, if there's swelling in the knee, definitely we shouldn't sit on the knees because the body weight will be aggravating the swelling. So yes. I threw Warrior 1 away years ago. It's a destroyer. Siobhan, explain. Explain yourself. Lisa, I know your problem. Yeah. Warrior 1 is for me one of the most challenging pose. I feel ashamed, lol, but now I feel it's okay. So lunging is better than Warrior 1. There might be some rotation in your knee in Warrior 1. In that case, just do a lunge, especially if you have a knee injury. It's better to do a lunge. There's no rotation in the knee than a Warrior 1. Okay. Now I can put my feet at the back, though. Thank you, Pee-wee and yoga. Okay. Lunge is a great substitute. I did have a tear in my MCL and LCL last year after a hike. Okay, that kind of explains your Warrior 1. Now I understand. MCL and LCL. So you have a tear in the front and the back. That means you can't twist at all in any direction. That explains why Warrior 1 is difficult. There might be a little bit of scarring as well there. And absolutely, just go for a lunge position, which keeps your knee in a neutral position and doesn't cause any kind of rotation. Okay, Sofiana, do you have any input for people who their knees make a cracking sound when they bend them, squat or bend? I think that was something that Yute was talking about, the cracking. Okay, first of all, the cracking sound might not be bad. It's only bad if there's pain attached to it. If there's no pain attached to it and your knees crack, well, don't worry about it. Usually it's like a vacuum happens with your connective tissue and it pops. The vacuum seal is removed, and that's not a bad thing. Sometimes they say it's air in the joint, but I've been told by orthopedic guy that cracking joints is not bad. It doesn't lead to arthritis. This is urban legend. Okay, Siobhan, Achilles tightness, foot compression, and medial ligament. Okay, make Warrior 1 problematic for me. Yeah. So just do a lunge or just don't do it. So yeah, medial collateral ligament, definitely throw out the Warrior 1. Okay. Awesome. Anyone else want to say anything?
Pee-wee, can I add something about arthritis?
Yeah.
Usually, most of the times, any kind of arthritis is linked to an emotional trauma. So, and that's why people with arthritis, when they start yoga, they start to feel better, and not only because they start to move, because things start to move out of them.
Yeah, you know, talking. That's great. Talking about knees, that knee pain is usually linked to you not being able to accept where destiny is carrying you. For example, you want your life to go this way, then all of a sudden you get hit by a curveball and life brings you this way, but you're like, no, I don't want to go this way. I want to keep going this way, but you can't keep going that way. So what happens is knee pain.
Yeah, exactly. So basically, the more breathing also helps a lot, and not only not only the physical yoga, like especially because I still remember when I couldn't even bend my legs to move. It was the breathing techniques I started using and the meditations, and then the small movement like the gentle yoga, and then we move on and on and on. So it's a process, you know, and it's a healing from inside, basically, to start with.
Yeah, absolutely. Okay, who is talking? I put it now into gallery view, so we can see everyone who's involved in the Zoom call, and so you will have the name of the person that is talking. Okay, Ruba, you wanted to say something? Yeah.
Yes, I have 2 students who need their knee replacement.
So it's really challenging for the knee, exactly, because they can't do most of the class because the other students want to sit on the chin, and it's really hard for me to manage them. Plus, they want to be involved. Like, no, I can't do this. No, I really, I feel like
yeah.
they don't want to feel like outsiders or something.
Yeah. I think that if there's two of them, I don't know if they'd like to, I'm not sure if they want to do a private session. Because, you know, it's very difficult with this because especially if you have an injury, it's very hard to accept that you can't do anymore what you used to do before.
And this is why I ask you, because they insist to do cat-cow. No, this is good for my spine, so they insist to do it. They insist to do bear dog.
Yeah, well, maybe they can do it, but not on their knees. You can still do cat-cow, not on your knees.
Yes, and I've tried to do this. No.
But they still want, okay. Well, just keep it open. Of course, it's their choice. But just keep it open and say, at any point, if it hurts, you can do this instead.
Yeah, this is what I do. Like, listen to your body,
yeah.
please.
Yeah, but still, it's their choice, and I think you should also give them the freedom to try and do what they can do. Just so as long as they don't feel worse after the class. Yes, Munira.
I am actually very eligible for a knee replacement, which I have been postponing for the past 4 years. And I still practice all the asanas that PV is making us do. So what I do is, especially cat and cow, as you said, ask them to put pillows underneath the knees. And just go ahead and do it. And just leave them alone, because they can go as far as they can and they'll never feel out of the class.
Yeah.
And at times you just have to accept certain things, because I went to the surgeon and I said, yoga is passion for me. And will I be able to do yoga after my surgery? He said, yes. And I said, can I jog and run? And he said, you can a little bit. Can I dance? Then he said, okay, show me what you can do. And he said, just go and save the knees that God has given you and come back to me only when you're ready. So it's past 4 years and I'm still without the surgery. Yes, right now I feel maybe I'm ready for the surgery, but I still can do all the asanas.
Yeah. So it's really it's a person's freedom of choice, but at the same time, suggest knees under and you know, modifications if the range of movement won't allow it, but they need to be the ones to decide this. What we need to remember as yoga professionals is we don't own anyone's body. They own their body, and you need to give them the freedom of choice whether to do what you want them to do or not, and always leave it open in your classes for people to decide which way they want to go. And that's going to make us more powerful in our ability to help people. Okay. So that was MCL and LCL. You know, it's awesome that there is people with all these injuries in this group, so that at least we can sort of, like Carla has a, what is it, ACL, Carla? Yeah, ACL. So people have different injuries. Damien, you want to say something?
Yes, since we're with knee problems. Actually, I've had knee problems for the past 10 years. I would like to confirm that the fact that the knee pain, when you really don't agree with the direction of your life goals, that's really true. I was thinking a lot about this, and then you just confirmed it. I have patella femoral syndrome, or melting patella, in my left leg, and it really hurts these days.
Explain to everyone what melting patella is.
So that is when when you're overusing your lateral or sides outside part of your thigh. So this is the lateral vastus of the quadriceps, and this is here is tensor fascia lata. So these two muscles, they pull the patella outside. So when you're overusing them, usually because of stress, and I'm a kind of a very, very energetic person, so I rarely sit. And then this pulls my patellas outside. So it means that the outer ridge, like if we see, this is the ridge of the femur. So the out one is being more rubbed. And that is the time when the patella starts to actually wear off the cartilage, and the cartilage starts to soften. And then the problem starts. So actually I have pain here, especially on some poses when I bend the leg. And this is stretch, so extension of the and bending. For example.
Okay, that is because, just to add to that, that is because when you bend the knee, patella rotates to the outside more.
Yes. And also this muscle pull that time. But so this so one of the how to say treatment plan for that is to increase the function of the inner muscle, inner part of the quadriceps, which is called medial vastus. And then that usually goes with semi-crouched poses that way, or even better this way. So this Northern Warrior actually helped me a lot. While we were doing the 200, actually, when I came for 200, I had knee pain, and then after a month, vanished. Actually, like 3 months ago, when I was locked in Macedonia, actually, I was hiking a lot with my youngest daughter on my backpack. So that's the time where usually I develop this one. So for me, hiking is not the best option, but cycling is very good for my knees.
Because it helps your quadriceps strengthen.
And I realized one exercise which is good. This helps a lot. So slightly open legs, and then you go, I don't know the name of the pose, properly ground on your toes. This engages the vastus medius and medius. Very, very good. So this is very good exercise if someone has the same issue.
That's very awesome, and thank you for sharing.
And one more injury happened, maybe you know maybe better. So last year, also I had a stressful period, but at that time I didn't practice yoga, but I wanted just to do half lotus. So when I lift my leg, right leg, I put it on my left hip. No pain, but I just heard like squish sound in my right knee, in the inner side. Next day, puff knee. And that was for a year. So I'm not sure what happened, either MCL or meniscus, something torn.
It sounds like meniscus. It sounds
something
like torn, probably,
but it healed. Eventually now it's good. So my right is good. Sometimes hurts, especially if accidentally I hit something from the inner side of my leg, it might hurt, but it's much better.
It sounds like the medial meniscus, the meniscus on the inner side of the knee. And usually if you get the meniscus tear, there is swelling inside your knee, either inside your knee on the inner side or inside your knee on the outside. So if it's a lateral meniscus, there'll be swelling inside your knee on the inside. And if it's medial meniscus, there's swelling on the outside of your knee and the inside on the lateral side. It takes a while. If you didn't go to a doctor, then that means that the tear was probably in the portion of your meniscus where there still are blood vessels, and it was able to eventually naturally heal.
It did, actually.
Pee-wee, can I add something for, maybe it might help Damien. Damien, are you vegan?
Yes.
Since how long?
Well, past 3 years somewhere, but I took occasionally dairy products.
Okay, no, it's not about dairy, basically. It's about collagen. Because when you have problems in your cartilage, it's about collagen. So, so also, whoever wants to know more about this and about ways, especially vegans, to increase their collagen, yeah, please DM me in private, and I will help you. Or if all are interested, I can share on the group as well, because I know.
Maybe you can just, Rita, go ahead and share it on the WhatsApp group.
Yeah. Okay.
If you got any information on collagen, because yes, this is valid to help with our issues in our joints if we are
Exactly,
vegan.
because vegans are basically developing cartilage issues and knee joint and the knee joint problems, and the meniscus become also very fragile, especially if we are exercising and you're hiking or dancing or jumping or whatever. So they get really weak due to the diet.
Okay.
Yeah, I just want.
Okay. Okay, now let's just want to talk about medial and lateral meniscus. Medial and lateral meniscus would be treating it the same as an MCL or LCL. Okay, again, medial meniscus and LCL the same, lateral meniscus and LCL the same. So the recommendations for LCL, lateral meniscus, okay? For MCL, medial meniscus, but also check, as I said before, if they're hyperextending. Because when you hyperextend, the knee externally rotates. And if there's external rotation in the knee, the medial meniscus is the one that gets injured. So just maybe check and make sure that they will avoid from now on hyperextension of the knee so that their medial meniscus isn't aggravated more. Okay, good stuff. Okay. Any other questions? Oh, here. Just another thought on knee protection. The synovial fluid lubricates and protects the cartilage. Since most people are in a chronic state of dehydration, the body has to ration water. The spine and the joints are often the first in line to lose fluid. Absolutely. So definitely, and same goes for magnesium. Absolutely. If you know all these people that drink too much coffee and they don't drink enough water, definitely they're lining themselves up for some kind of joint injury or spinal injury. So absolutely, everyone reaches for the water. Okay. Right. Good stuff. Yeah, magnesium was more linked to muscle spasms. Okay. I love these chats. They're you guys are awesome. Okay. So those are the issues of the knee. And hopefully we've got a little bit more enlightened about how to handle knees in yoga classes. I believe that it does help for someone who just recovered from a knee injury to have 1 or 2 private sessions to teach them how to move and to give them additional exercises for them to be able to do to help them with their injury. And so that you don't have to disrupt your yoga class to tell them in the middle of the class what they should or should not doing. So maybe those 2 ladies, Ruba, in your class, you know, if it's needed, you can say maybe you guys want to have just like, you know, a session with me, the 2 of you, where I will show you other things you can do so that you don't, you know, because it's quite distracting. Yeah, sun salutations, hard on the knees. Sometimes, you know, you can put knee pads on in a yoga class just for those parts where your knees have to be on the floor, or you can get these little gel pads or a cushion. Yeah. So if you've got a beginner with a knee injury, you're probably not going to do the sun salutation yet. But there are other things you can do aside from the sun salutation. You can do a half salutation. You can just cut out the part where you go onto the ground. Have you seen the Pilates one? Extended mountain pose, forward fold, walk to down dog, walk back to forward fold, come up again. You skip the whole entire issue with going on your knees. So maybe that is something that you can do. Yes, thank you for Lisa asking them to exaggerate bend on knee at the beginning. This always helps for a new person so that they don't get into the habit of locking the knees. Okay. Okay. Any final questions about the knee? Okay.
Actually,
yes.
When you said
okay.
that,
one by one. Lonica, you're next. Okay. Rita.
Okay. Go ahead. Okay. So when you said that about bending the knees, wouldn't this be advisable for everyone who has knee issues, whether they have arthritis or meniscus tear or whatever, to never lock the knees in any exercise?
Yeah, I mean, no one should be locking the knees anyway.
Right.
Okay. Whether you have a knee injury or not, no one should be locking the knees. That's just full stop. Don't lock the knees. Yeah. Lonica, yes.
Yeah, just a question I remembered. I had an injury on this inner part of my upper leg for a long time, and if I touch it, it's still very sensitive. And I wonder if that's connected actually to the knee.
That could be the top part of your lateral collateral ligament, but it looks a little too high. Oh no, that does look like the top part of your lateral collateral ligament. If it is the top part of your lateral collateral ligament, then that is linked to external rotation and might have an, you might want to check how much your femur external rotates to make sure that you're not overcompensating by external rotating the knee. That's one thing. You might have not felt it, but you might have gotten into a situation where you strained that ligament from like a sideward blow or a sideward movement that strained it past the point, because it keeps your tibia from going inward, no? So there could have been some sort of sideways movement that caused it to strain, and external rotation never got it to rehabilitate. Strong inner thighs. How's your inner thigh strength? Because strong inner thighs can help.
Yeah, I'm thinking of doing that by just to strengthen that more.
Yeah, and
to protect.
Yeah, and as Damien was saying about the vastus medialis, and that might also help because it's near the MCL as well. So you might want to look at strengthening the vastus medialis also, and the inner thighs as well.
But it's also, I think, connected to like an energy line, right? From the big toe,
Yes.
all inner. This hurts as well.
Yeah.
The inner.
That's the
down.
that's the Vajrayani Nadi.
Yeah.
That's the Vajrayani Nadi. So maybe a little bit of tapping. In Korea, we tap the area and we exhale through our mouth. Tongue out, eyes up. You know the deal. You've done this a lot. Jade's your neighbor, no? You can ask her to help you.
I'm taking classes with her every week.
Good. Just that she's a physical therapist, so you just tell her about it. I'm sure she can give you more advice.
I will. Thank you.
Yeah. Yeah. Okay. Tell her I said hi. Also, I miss her. Okay. Good stuff. Anyone else? I think we're good. Yeah.
Huey?
Okay. Yes, Aliyah.
Yeah. Can you hear me?
Yes, I can hear you perfectly.
Yeah. Pewee, do you remember the issue that I have with my knee the inner part of my knee in Upavishta Konasana. So it was a mystery and you solved it. I have no idea what was going on. So it was in Upavishta Konasana. When I internally rotate my thighs, I will feel in my, I will feel it in my inner part of my knee. I will feel the pain. So I have to hold the Upavishta like one external and the other internal. So what was the problem?
It could be the medial collateral ligament. It could be MCL. It could be MCL or the medial meniscus. Getting a little bit of a twist because it's the inner part of your knee. So yes, we solved it by not letting your knee roll in. It sounds like medial collateral ligament actually, because remember when there's a little bit of strain in the thigh rolling in too much, and if there's a little bit of injury in that medial collateral ligament, you're going to feel a little bit of pain because it won't be doing its job of keeping the thigh from going in. So it might be that. It might be structurally that when you do Upavishta Konasana and you internal rotate the femur, it causes that knee to external rotate for some reason. And so preventing the thigh from internal rotating keeps everything. So I really think it's MCL. Because the pain is on the inside of the knee where that ligament is. It's somewhere here, right? Like somewhere here?
Yeah, it's here.
Point, yeah?
Inside.
Right? It's inside,
Yeah,
right?
yes, exactly. Yeah, the same point. Yes.
That's exactly that point. That's medial collateral ligament. Yeah. Okay.
Okay, thank you very much, Piwi.
Yeah. Okay. Okay. So what we're going to do now is we're going to take a 15-minute break. And then we're going to talk about Yoga Sutras. Okay. No?
Pee-wee,
what are we doing?
Aren't we going to do yoga?
Oh, we're going to do some yoga. We'll do an hour.
Yesterday.
We'll do an hour of yoga. Okay, we'll do an hour of yoga.
First or sutras first?
No. We'll do an hour of yoga first.
Okay,
okay.
I'm
And this is what we're, yes.
I'm missing your power yoga sessions. Really looking forward to it. Hopefully
we're going to do yoga. We're going to do yoga, and I'm going to make it a knee safe class. Okay, so if you listen to my cues and you listen to the activities that we're going to do, it's all about the knees today. Okay, so maybe do an hour and a half, possibly. Who knows? Of yoga. Yes. Okay.
Is it okay? Right. Is it okay if we just finished eating?
Yeah, it should be okay. I'm not gonna do too extreme bendy stuff.
Okay.
Okay, it's not gonna be extremely bendy. Okay. All right, let's go. 15-minute break. We'll just set up the camera.